Okay. Hello, everyone. Thank you so much for joining us for our next item in our series of Campfire Chats. We've had these going all summer long, and tonight is kind of a repeat. We tried to do this one a few weeks ago and had some technical difficulties. So Sarah Nelson Taylor is joining me tonight to talk about healthcare access. So, Sarah, I'm just going to dive right in here. Um, tonight's chat is just talking about the healthcare system and how sometimes it can feel a little bit overwhelming. Especially when you're talking about a rare condition like CMN. I'd like for you to share just a little bit about your own journey or what you've seen others experience when it comes to finding the right doctors and specialists.
Yeah, so we joined the CMN community by storm on January 11th of 2024 when our youngest daughter Nora was born. And like many families with patients or with kiddos with CMN, it became very apparent at birth that she had a giant congenital nevus. She had some complications, including some tumors that had to be removed in the first or few days of life that required a NICU stay. But really, we just rapidly became aware or more acquainted with this condition shortly after her birth. That being said, we were incredibly well positioned to navigate her healthcare journey because I am a board certified pediatrician. I'm also a pediatric nephrologist. I have a PhD in cancer biology that studied the RAS-MAP kinase pathway in lung cancer, not in skin cancer, but in lung cancer in adults. So we had kind of an uncanny pre-existing amount of knowledge to kind of help us take care of Nora and to navigate healthcare systems in a way that so that we can fully take advantage and make sure she gets the right care. Fully knowing that that is a pretty uncommon place to be coming from as a parent of a kiddo with CMN or of a parent with any chronic condition as someone who works in the hospital that she is often seen, I know how to navigate those systems and how to kind of the ins and outs of how to navigate and advocate for her.
Yeah. And I'll just echo that is an absolutely uncanny experience. I talk to families every day who connect with Nevus Outreach who aren't in a position where they know anyone or have any prior existing knowledge. I know even when my daughter was born at my we're in a rural area, but it's a town of 100,000 people. It's not tiny. It's a little college town in Northeast Arkansas. They were like, we think this is what this is. We're not entirely sure. We're going to get you to pediatric dermatology. But then it was a 6-month wait before I saw someone that was like, oh yeah, that's congenital nevus. That's what that is. And so, you know, my experience is probably a little more typical. And then and we know what it's all like to be, to have that news. And then, of course, what we all do in today's modern age is we jump on Google and, whatever
That's the worst
happens,
thing I'll
happens
do.
from there, sort of.
Yeah. It's and that being said, even though Nora was born at the University of Colorado Hospital because that's where insurance pays for us to have deliveries, which is a major academic medical center with a major academic NICU, and none of the people who were on at that hospital had ever seen anything like that. There was a lot of confusion with her too, especially with the tumors about whether or not this is like a hemangioma type lesion or what exactly was going on. But we were able to, and these were, friends of mine were the attendings on taking care of her in her first day of life, but because, knowing the questions to ask and knowing who to advocate to and how to advocate is really helpful at effectively expediting care when appropriate and kind of elevating concerns as appropriate and working that is it's a very nuanced thing. So I'm excited for this opportunity to talk more about this with the Nevus community.
Yeah. So what advice would you give to families who are, just maybe a few weeks out even from that delivery room experience, or maybe they're experiencing some new challenges like a spot that has popped up or something that they feel like they need to get checked out, and just really aren't sure where to turn for care or what kind of providers they might need, or just really having a time making decisions in their child's care.
Yeah. So there's a lot to unpack in that question. I think first and foremost, and this is true of not just children with Nevus, but having a good pediatrician is imperative for all children, but especially because when you have complex diseases, they're often the one who can advocate for you earliest on within the healthcare system to help you access the care you need. So if you are a family who just had a child that has been in what we think is diagnosed with a congenital melanocytic nevus, but you haven't seen dermatology yet, working with your pediatrician to kind of help access that care can be really helpful. A good pediatrician is an advocate for you, not only a physician for your child, but an advocate for you in terms of in terms of navigating larger healthcare systems. If you need, sometimes it requires parents to have a little bit of savvy and knowledge to ask the right questions. But if you are, on a 6 to 9 month waiting list for something that seems or feels like it should be handled more urgently, and we can talk in a second about urgency in the medical field, because it's often different than what parents kind of interpret it as. But your pediatrician, you can ask your pediatrician to call the on-call number at your local children's hospital. That is a way. It's a doctor-to-doctor communication line that exists at almost all major academic children's hospitals that I'm aware of, especially at least at ours, but at all. Usually, it's a community service that's provided by those hospitals to kind of provide informal consultation or kind of advice to local pediatricians. And it's a way to formally expedite care. So if they've put in a referral, but it's going to take 9 to 12 months to be seen because of the what's the word I'm looking for? The lack of pediatric subspecialists that currently exists in the United States, your pediatrician can call this number and say, hey, I have a patient that I'm concerned XYZ. I think they need to probably be seen in the next 3 to 4 months, which, it seems more appropriate. They can advocate for you in that way. And sometimes it's just bringing to their attention that these phone lines exist because it is hard to know all of the resources in a community. So asking your pediatrician to advocate on your behalf to the local hospital, because a lot of times, even as a subspecialist myself, I see patients that have waited a really long time that probably shouldn't have waited as long, but we just didn't know that, the referral we got didn't have as much information as it needed to have, and we needed someone to advocate for them to be seen sooner. We all have urgent appointments, so we can get patients in urgently when it is deemed urgent, when we all feel that it is urgent. And so just knowing how to navigate that and advocate for that. I think this brings up an important kind of thing to discuss is what is urgency in the medical world, because knowing kind of how physicians think about urgency can really help you know when to use certain resources and when not. So anything that you are worried about and you expect a phone call or a communication back within 24 hours needs to be a direct call to a nurse line or a visit to the emergency room or an urgent care or a same day appointment. The online portals that you have with your physicians are really, really powerful. But in general, the expectation kind of professionally is that it's a 72-hour turnaround. So, and that's 72 hours in terms of business days. So if you if you send a message on a Thursday through the portal, you may not hear until Monday and Tuesday, and that's within what is expected or what that portal is used for. So if you feel the urgency is more urgent than that, you should call the nurse line at your physician's office, or you should escalate, call for an urgent appointment, be seen by urgent care, be seen by the emergency room. If the portal is excellent, especially for questions about the nevus, because we can take pictures of it. It's really great. It can communicate a lot more effectively in a picture. So if you do see a change, that's a really important thing to be able to communicate to your dermatologist in the portal, and they can help you figure out how urgent it is and how soon they need to be seen. Most things in medicine are not urgent. And not urgent in a resource limited field is going to be 2 to 4 months, because that's how we preserve time for to be able to see urgent patients on a day-to-day basis. So I know, and it can feel like you're using that portal to kind of ask what you feel like is an urgent question that you want an answer to more quickly. But I think knowing when to escalate, if you are concerned, if If there's a new lesion in the nevus and it's bleeding and you can't stop the bleeding, that's an emergency. If your child has NCM and they're having a seizure and they've never had a seizure, that's an emergency. If there's a change in the nevus, that's probably something that can be handled within like that 48 to 72-hour window totally appropriately, and is not necessarily something that has to be dealt with that day, but should be dealt with like in the next few days in communication. And so giving your providers grace and working within that format can really allow you to advocate more effectively and efficiently within like how our healthcare system is set up, just given that everyone has 8,000 more things to do in a day than we currently can get done.
Yeah. Yeah, I think it's really important for people to understand that as a worried mom at home, and dad, I guess, but a worried parent at home, your timeline is one thing, and just what's possible at your provider's office is typically very different. So
And
that's difficult.
and we, at least in our office, it's different in nephrology. We have different questions, but we have the same, we think about things in the same way, and we've set things up to keep patients safe. So it's not that we've decided that these things are like we just can't handle it because we don't have the bandwidth. That's how we've triaged our patient complaints, and things get escalated when they are appropriate and when they are not. And then they're handled with a timely basis. If you are anxious and not sleeping at night about your child, the change in your child's nevus, you should just call the nurse line. Just call. They will tell you, we will get back to you in 48 to 72 hours. And if they don't, you can call again. But giving grace for the system to work as it is designed can really help in terms of successful advocating and then efficient advocating too. Because not only do doctors have a lot to do, like parents have a lot to do, that your system is set up to take care of your child, not the opposite. And I think that it often feels antagonistic and it often feels uncomfortable because it's not a system that parents are used to working in or kind of navigating. But it is set up to take care of your child well.
That's so true. Let's talk about another type of challenge, insurance and referrals and all those things. Those can sometimes be big barriers. Do you have any strategies, Sarah, or resources that have helped you overcome these obstacles or that you've seen parents use?
Yes. Insurance, man. Just know that your physicians struggle just as much as patients do with insurance. First and foremost, knowing your insurance policy is really important. There are tens of thousands of different insurance policies available in the United States. Your physician does not know your insurance policy. If I, as a physician, like the extent to which I can see someone's policies, I can see the company that they go through. Like I can't see what their deductible is. I can't see if they have I can't see anything about their policy. So that is really on families to really know the ins and outs of their insurance policy. And to know when the date, when does it turn over every year? Is it like December to December? Is it July to July? Is it, when does your deductible turn over? Knowing what your deductible and out of knowing what those numbers are for your policy is on the patient. That being said, knowing that and understanding when things are elective and not can help you advocate for appropriate timing. I often, it's the summertime and I work in a city with a lot of academic people. So a lot of insurance policies turn over on July 1st. I will wait to order testing until after July 1st. If you want to count towards the new deductible, I will also order it earlier to help it get in on this year's deductible. So kind of communicating that in a way that can help you, especially for things that are not urgent or not emergent, there is flexibility, whether you get labs this week or next week, whether you get an MRI in August or in October. We are here to work with you to make it as financially flexible for you as possible. But that requires you to know your policy. I think one of the biggest places where, especially in pediatrics, patients and families with private insurance policies can really get burned is whether providers are in network or out of network. It's hard when you say you're pregnant, you have a baby, they are diagnosed with a complex congenital disease, and then you find out your insurance doesn't cover care at the local children's hospital. So that's, you didn't know that when signing up for the plan. But for figuring out who's in network, who's not, and how to negotiate that, and how to look for a policy that includes your providers that you need to see, especially since things like or specialties like peds dermatology, peds plastic surgery are pretty small fields. So knowing and making sure that you do your due diligence on the front end to make sure your insurance covers the providers and the hospitals where you intend to seek care. When it comes to prior auths, I honestly, we are in the weeds with everyone. I don't have any great tips or tricks. If we did, they continue to work to outsmart us so that we don't have great tips or tricks, because that's like kind of the point of the prior auth. And AI is just rejecting everything, and give grace to your nurses' offices, because it's usually the nurses in the office that are doing kind of the most administrative work and chatting and talking with insurance companies. And that is a really awful, thankless job, unfortunately. So give grace to your nurses who are way more phone calls than you're aware of to try and get things figured out. It seems like nothing. But I wish I had better tips or tricks for that. But
I will say, see if you don't understand your policy, see if your workplace, even your HR department, has a healthcare navigator. That sometimes in different companies they have something like that. I know my husband carries our insurance right now through his work, and they have an app where it has chat function and all kinds of stuff. It'll help you find a provider. It'll do a lot of things. But it helps me a lot, as most of you know, in our community, I have 4 kids at home, all with their own like kind of complex situations, type 1 diabetes and other things too. So I feel like I'm always having to kind of navigate and push into the healthcare system a lot. And if it weren't for some of those resources that we've had through that HR department, has been really invaluable. I'll also say, Sarah, I know we've talked about this before, social workers at your local hospital.
So that was something I was just realized that one of the things I think is really important, this is not true for adult care, but no, there are enough organizations and resources in the United States to ensure that every child gets access to care. It's just knowing how to utilize them and how to find them. And there are a lot of really private, small foundations that give grants to families. There's many actual organizations that will fly you to care if you're far away from the care that you need to get. If you need to be seen at a children's hospital or a subspecialist that is far away from your home and that seems overwhelming or unmanageable to you, I want you to call that clinic and say, can I talk to your social worker? Or can I talk to your health navigator or your case manager, or who helps patients get to appointments when it's challenging? They're called something slightly different at every institution, and they take on slightly different roles, but there are social workers, and there are, at least at our institution, they're called health navigators, but I hear that that's not what they're called everywhere, that really know the ins and outs of all of the resources that are available to families. In Colorado, I see patients who come from the the Canada border all the way to the Mexican border. And I have patients that are flown in for appointments as our health navigator kind of helps facilitate. So if you are finding it difficult to access care because of geographical distance or because of like monetary concerns, financial concerns, especially if you have Medicaid or your children Medicaid, talk to the social worker, talk to the people in the office, in the clinic, because we are at children's hospitals, we exist to take care of children regardless of where they are. And those resources do exist. It is just hard to figure out who to talk to and get access to them. And I think empower everyone to, if you feel like it's overwhelming or too hard or not going to happen, or that you're in Idaho and you need to go be seen in Seattle, like talk to the social worker at Seattle and say, hey, like, is there anything you can do to help me get to this appointment, or help me with like around a McDonald's house or a hotel to stay in, or
Absolutely.
Gas cards. We give out a lot of gas cards just because of where we are and how far people have to drive to kind of help get access to that care.
Absolutely. There's a lot of I know Kim Hookendorn's been a strong Ronald McDonald House advocate
Mhm.
for a long time. They stayed there when they had to stay at Mayo once upon a time. I mean, there's so many families who have accessed those resources over time. And to that end, if someone is in that spot where they just feel like, oh, I'm really overwhelmed, I don't know what to do, call the Nevus Outreach Office. We will help
Yeah.
you. And that's a
Mhm.
great
Yeah.
segue.
Yeah.
Uh, so, what role do you think patient advocacy or other organizations like Nevus Outreach can play in just making the healthcare access journey a little easier for families? And that's kind of that same point. Yeah, we're here to support you.
Yeah, so not only is Lauren an incredible advocate for patients who need Medicaid approvals or need, help navigating systems, the role that Nevus Outreach plays in terms of educating parents is really important. Um, and this is very common, is that in the world of pediatrics, many diseases are rare. And because there are so many rare diseases, um, even if we as physicians are familiar with and kind of understand how to treat, parents are often the ones who are most informed about the most up-to-date like papers or reviews or standards of care. And so bringing that up with your healthcare team is not only, don't ever think that it is like worst case scenario, they've seen it and they are aware, and you have a great healthcare team who's up to date on things. Best case scenario is that that's something that they haven't seen or heard yet, because we all have 10,000 things to read on our back burner. And I have patients with other very rare diseases who go to conferences or family related events, and then they come back and said, have you heard about this? Have you heard about this? And I may say, I've heard a little bit about it, but I honestly, I haven't read this paper yet. And they can often fill us in. And so,
Yeah.
um, patient and parent education is really critically important for rare diseases. Um, and it can be really helpful in terms of kind of arming people with the tools they need to advocate for their child, and then understanding what kind of standards of care are across the country, across the world, and how they differ, because every institution is still different. And there's different cultural practices. There are different, practices in terms of how people trained, where people trained. And that doesn't mean it's bad or bad for your child. It's just that medicine is an art, and many of us have slight variation to how we practice. And knowing what questions to ask when you see something slightly different than you're expecting is really important.
Absolutely. And I think I just want to let the community know also that we hear and understand these access challenges that people face every day, and we are committed to developing more resources. We're working on some projects with our website in the next couple of months where we want to roll out some changes to just make things a little, oh, you need the best practices document. Well, you can search for it at any time, but like making it a little more clear, especially for new families who are finding us for the first time, the information that they need from the jump. So we're constantly working to get better ourselves at equipping families to make these decisions. But I think that the conversation tonight, Sarah, has been something that I think we'll link in of course, that'll be on our YouTube and different things. But I think it'd be a great resource too for those parents starting out. And just remember that you quickly do become that expert. And I know that I've heard this, I've experienced it myself, of course, but had other families even share with me. I can't remember which one was born first, but thinking about Neva's kids who were born just months apart at the same hospital, and the team's like, "Oh, we just saw this like 3 or 4 months ago," and thinking about that makes a big difference. You know, if you're at a more rural hospital where they've never seen it, it can be a real challenge. We walk
And
families through a lot.
telling your healthcare team, especially when you're talking about like local pediatricians who are honestly probably excellent doctors, but don't see everything on a day-to-day basis. Saying, here's the resources that I've seen. I often will check out websites for organizations that are disease specific, to see how are they communicating with families, and they're an easy way, as Lauren said, to find best practice documents, to find updates in terms of the newest research. And even my pediatrician, who was my kid, or not my pediatrician, my kid's pediatrician, who I in my general pediatrics residency training under had never seen this, and looked up the best practices document and like armed herself with that information. And she practices at a major, within a major academic medical system. And so, being able to kind of support your healthcare team, even though it is not your job to do that, let's be very clear, but being able to share the resources that you find through Nevus outreach is kind of a foundation of why you might have certain questions, can be really helpful in terms of orienting the people trying to take care of your children and yourself, and also kind of help further educate them about this rare condition.
Absolutely. And Sarah, as a social worker trained, that's what my bachelor's degree is in. This
Yeah, like the
conversation
world
makes me
runs on
really
social.
happy.
Like we would never get any. The social workers are the backbone. It's really
And just recognizing the work that they play in the medical system and helping families navigate it, and what an incredible resource they can be, just makes me incredibly happy. And thinking about, as we, kind of forge forward here at Nevus Outreach, like what can we do to make sure that families and physicians, who land on our website, after a long delivery and all those kinds of things, because that's how it happens, and we're trying to figure things out, make sure that it's readily as accessible as it can be, and very clear to families to get the most up-to-date information as quickly as possible. So I just thank you for having this conversation. I'm really thrilled that we have your leadership and expertise on our board of directors, as of late, and I really can't wait to see how we really evolve in this space and kind of take this charge on to say, okay, yes, we did have information available on our website, but like a year from now, it's like that much better, and we have different supports in place that we didn't have, that we don't have today. And our team is actively working on those things. So I know that, and so I'm like really excited, because I know this is the beginning of a conversation that is just going to be that much richer in the next 12 to 24 months.
Yeah, families are never alone. The goal of pediatric healthcare is to help children and to help families. And if you feel alone or you feel lost in this journey, ask people either within our organization or within your pediatrician's office or your local, children's hospital. We're here to help and waiting in the wings to help, but we can't help families if we don't know what their concerns are. So speak up, be vocal.
Absolutely. And our door is always open. There's a contact us box at the bottom of the website. There's a phone number there. There's email address there. We're here to support you, and we want to make sure that everyone can navigate these systems as well as. I'm not saying they're not challenging, that there's not things that make us crazy, all of us, but at the same time, as best we can do it for every family, for every kid, and even as into adult care. I mean, that's even a whole nother challenge that we really feel the pressure kind of to help people navigate that departure from pediatric care to a community derm office, and what does that look like. And we just had some conversations in the last couple of weeks about how can we make sure that even community derm offices are more informed of CMN and things like that. So it's certainly not going away on the radar anytime soon, and we are working on those things. So I just encourage everyone to stay tuned, and please reach out if you need us in the meantime. All right. Thank you guys so much.
Bye, everyone.